Ready? Okay. Make sure that you know that the clavicle has two curves in it, and the most proximal curve is convex, or else it's bowing out. That's going to be something that's important. So make sure you know this is convex, and then this is concave. We're going to come to the concavity of the clavicle and go down about 2 inches. At this point, my finger lands on a part of the scapula where 3 muscles insert. You need to know what 3 muscles those are. From this point, when we palpate this bony process, which is called the coracoid, we are going to externally rotate the humerus, and we're going to feel it kind of punch out. If you're too lateral, you're going to be on the humerus, and you go feel that swivel underneath your fingers. It's not going to be punchy, it'll be swiveling. So make sure you come to the coracoid and feel how it hinges out whenever you externally rotate the humerus. For Dr. Cantu, boom, come all the way out here to the concavity of the clavicle. I go down 2 inches, and this is kind of where there's a curve in the chest. Like you can feel the deltoids meet the pec right here, and there's an indentation. I'm going to compress into that just like this. I'm going to squeeze into that with my fingers and then support with my thumb on the back side. It may be a little bit of tender on the person you're palpating, so be careful. Underneath my chiropractic index finger, I can feel bony resistance. I want to confirm that it's a coracoid. So from this point, I go like this, and I do feel it punch right out into my finger. That's the coracoid process, bony resistance. The next things we're going to do are I'm going to palpate in the front of the person. It's going to be the olecranon, which is on the ulna, and then the radial head. So to find the radial head, the best way to do that is find the lateral epicondyle. Here's your lateral epicondyle. Here's your medial epicondyle. From this lateral epicondyle, you're going to hold your arm in your waist just like this while you're palpating on yourself so you can find your own. Then I want you to find lateral epicondyle down about 1 inch. Once you're down 1 inch, I want you to put your thumb there and then use your fingers supinate and pronate. Feel your wrist supinate and pronate. When that happens, you should feel underneath your thumb a swiveling of bone. That's the radial head. All right, for those, this is what it looks like. So stinking easy for the olecranon. You're just gonna put a finger on it. You'll learn how to adjust that bone later on, but I just wanna make sure you can identify what the olecranon process is actually. So you stand by the side. This is the bony resistance of the olecranon. If she's getting a better angle of it, that's what it looks like. Support their hand and then be on the olecranon. The radial head, I'm gonna show you on this side. I'm holding his arm, but I'm keeping an eye out of like where the hand is at. So I don't want it to be in the crotch region of the doctor. Be on the side. Find the lateral epicondyle, bony resistance, go down 1 inch, and then I want you to swivel their hand into pronation and supination and feel underneath your thumb the bony resistance. One important thing about the radial head. If you're down here, you're gonna feel a swiveling, but you're not on the radial head and you will not adjust it right there. If you're there, you're not gonna get points for that palpation. Make sure you're exactly right here on the radial head so you can feel it. That's where the best adjustments are made, really close to the joint level. All right, perfect.